Well, hello. So we've got John Curtis with us today. So, John, why don't you quickly, for anybody that doesn't know you, go ahead and introduce yourself and what you do at the retreat.
Well, I'm John Curtis, and I'm the president CEO of the retreat. And I helped start the retreat 22 years ago. Prior to that, I worked for the Hazelden Foundation for 20 years, and I'm a longtime sober person. I got sober January 2nd, 1976. So I come into this field honestly and from the heart.
I love that. And 22 years ago, you created a new way of doing things. The retreats model of recovery is different. It's unique. It's really cool to hear about. But tell me what sort of motivated you 22 years ago to come up with this new way to treat people who want to get sober and want to enter into long term recovery.
Well, I think it really started in 1991. The Johnson Institute put a conference together down in Florida and invited 50 professionals from across the field, from chemical dependency professionals, criminal justice, researchers, mental health professionals. And I represented Hazelden at that meeting. And the theme was, where are alcoholics going to get help in the future? And we could see the writing on the wall back in 91 that there were some trends that were disturbing. Managed care was starting to squeeze the bottleneck in terms of access to treatment, but
Hmm.
making it harder for people to get into treatment and stay in treatment. And the cost of care was going up, and
Hmm.
access to care was going down. So we said, this is not a good model, and
Right. Going to make it harder for people to get treatment if the
harder
costs
for
keep
people to
going
get
up,
help.
right? Yeah.
So from that meeting in 91, we came back to the Twin Cities. Dr. Mann was the founder of St. Mary's Treatment Center here in Minneapolis, one of the first hospital-based programs. And myself and a group of business leaders and medical directors from other treatment programs around Minnesota,
Hmm.
and formed a think tank. And we met once a month and brought in people from all around the country, different models of care. What could we do to help more people for less money?
Hmm.
And so we spent 7 years looking at different models of care. And so in 95, I wrote a business plan and called it The Retreat. And we rallied around that model. And it was really a 19-bed experiment at that time. Um,
Right.
it was looking back at the original Hazelden model at High Watch Farm in Kent, Connecticut, 1939. Bill W. and Marty Mann. Bill W. had just written the big book, and he wanted to create these AA recovery centers around the country. And
Hmm.
Rockefeller said, "We're not going to give you money. You can't mix money in AA. That's a problem." So Bill said, "I'm going to create a center for the High Watch and a place for people to go and study the big book and learn the principles of AA in a retreat-like setting." And looking back at the beginning of Hazelden, it was a retreat.
Hmm.
So we said, well, could we create a model that existed back in the 40s and 30s and 40s in this day and age that could drive the cost of care way down and improve outcomes? We started it in 1998. I left my job at Hazelden and was employee number one, and we had the old Pillsbury estate out in the western suburbs of Minneapolis. And it was, guest number one came in from West Palm Beach, Florida, and now since then we've grown. We've had 26,000 people from around the world go through the retreat. And it was a
That's
model
amazing.
that made sense at that time
Yeah.
and continues to.
Yeah, so for anybody that might be interested, or you might be viewing this video and you're looking into treatment for yourself or maybe a loved one, I want you to pay attention to this part. So, John, when people are researching traditional treatment, traditional recovery, maybe they have friends that have gone through a traditional treatment community. How would you say the retreat differs from a traditional treatment environment?
Well, first of all, the retreat is technically not treatment. We're a
Yeah.
supportive educational immersion in the steps and spirituality of AA. So that said, we serve people who know they have the problem and are motivated for change.
Hmm.
So if somebody comes to us and says, "Well, I'm not sure I'm an alcoholic. I'm not sure I have the problem, and I'm not really sure I want to recover," or I have a co-occurring issue, a mental health issue that hasn't been treated and addressed,
Hmm.
then you need a clinical treatment program with the full biopsychosocial assessment and all of the bells and whistles that go into a clinical treatment program.
Hmm.
The retreat is a unique setting. It's really, truly a retreat center. It's a supportive educational immersion in the spirituality and steps of the 12 steps.
Which
So,
is why we see the 12 in the logo right above your head.
yep, yep, the
Mhm,
language of the heart, the 12 steps,
mhm,
it is what we're all about. And it really, when we did this part of the think tank days, we brought in 50 people who had 10 years or more of sobriety.
mhm.
And we said, "How did you do it? How did you get 10 years of continuous recovery?" And then we wrote down their answers. And they talked about having a sponsor, being very active in AA, having a home group, doing service work in the community, having a strong spiritual program.
Mhm.
And we said, well, okay, let's create a model of recovery that is totally immersed in that solution, so that we're not as focused on identification of the problem, because we're serving people who already know they have the problem, and focus completely on the solution.
Boy, man, I love that. And for anybody that's watching at this point, long-term sobriety is the goal. Not just did you complete a program, but have you abstained from drugs and alcohol long term? Now, what I love about your program, John, is it seems to defy national average on long-term sobriety. You seem to have much higher numbers of people who really go and achieve that long-term sobriety. What would you say attributes you guys to that level of success and being higher than what the national average sees?
Well, it's a good question, and it's a complicated answer.
Right.
But I do think that part of it is we're so focused on the solution
Mhm.
that it's refreshing. 80% of the people who come to the retreat have been to 1 to 5 previous treatments,
Yeah.
so they know the words. They can't hear the music, but they know the words.
Mhm.
And so we're really here to kind of teach them the music of recovery. What's involved with being intimate and being vulnerable with one another? What does it mean to be humble and teachable? And
Right.
what does it mean to sit in the front row of your recovery community? Not just be a visitor coming in as a 5 and 5er, 5 minutes, come in 5 minutes late and leave 5 minutes early. We
Right.
want people who are, sitting in the front row and active. The other thing is that we have volunteers that come into the retreat to carry the message. In fact, the
Okay.
primary agent of change at the retreat are this amazing volunteer community that come in and carry the message of hope and recovery. So
Are a lot of these volunteers, are they past participants in the retreat, or are they?
some are alumni of the retreat,
Okay.
and some are longtime sober people that have had years of recovery. So
Mhm.
anywhere from 3 months sober to 55 years sober.
Wow.
And so we have 400 volunteers that come in and out of the retreat every month, and
Wow.
88 different AA and Al-Anon groups that come in and out to carry the message every month at the retreat. So it's a vibrant, lively environment. So if you want recovery,
Mhm.
uh, and you come here with an open mind and an open heart, you're going to meet a lot of people who have what you want, and
Mhm.
it's attractive. And that's really kind of the 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 spiritual essence of what the retreat is all about. We're going to connect people who want recovery with a community of people who have it. So it's not just at the end of your 30-day stay in treatment, we're going to give you a name and hopefully connect you with that person, and that person might take you to some meetings.
Hmm.
You're meeting the community of people that you're going to be interacting with on day one at the retreat, and you're nurturing those relationships for the entire 30-day experience that you're here.
Wow. Wow. I mean, the amount of volunteers you have and the amount of on-site meetings really starts to that word immersion that you used. That really stuck with me at that point. You make sure that is it's there. Every opportunity is there to immerse yourself in this process. And I want to highlight on something you said just a couple minutes ago. You said a lot of people come to you who have been through multiple treatment programs. One thing that I know about the retreat is you guys seem to excel with people that have been through multiple treatment centers. Tell me why that is. Why do you think you do such a good job at finally being that last step for somebody that's tried and failed 4 or 5 times?
I think part of it is that the way that retreat is structured, we require people to take the steps 1 through 8 while they're here,
Yeah.
and they're doing it for themselves, not for the staff. So they're not like performing and finishing assignments for their counselor. Uh,
Hmm.
they're doing it because everyone around them is doing it,
Got
and
it.
it's again very attractive and something that's very engaging.
Hmm.
Um, so they're around a lot of very smart people who are very dedicated to carrying the message of recovery, and it just bonds people together. And I think it's in designing the model, it was probably the greatest surprise for all of us when we set this up, that the energy that exists in a community to help one another.
Yeah.
And coming out of a very clinical program, which having spent 20 years at Hazelden, was a
Hmm.
fabulous experience and a great one of the finest treatment centers in the country.
Hmm.
Um, it was amazing to me to be able to watch the spirit of recovery happen from the community into the program. Um, and so I think that's been probably the greatest gift to all of us, is the
Hmm.
spirit of one alcoholic helping another. Um,
I
so
love
I
that.
think that, and when you get, men and women from all around the world who've been in and out of lots of programs.
Hmm.
There's not a lot of BS. I mean, they're really about like, no, let's cut through the BS and let's get down to what's really going on right now in your life, and let's talk about what's really important. Like, how do you
Yeah.
find joy in recovery, and what's it like to be rigorously honest and vulnerable. Um, and then we have 20% of our people who have never been to treatment. Uh,
Right.
but maybe their dad was a longtime member of AA, and the family was just waiting for Johnny to get ready. And
Hmm.
and actually, the outcomes with that group are even higher than the chronic
Wow.
eating group.
Which that's a big deal. I mean, if you're researching treatment centers and you're wondering, what should I look at? I would say that how many people have been successful through the program and how many people have really gotten that long-term sobriety. That's a great driver of a great program. And John, one thing I really hear you saying, when I think about traditional treatment and counselors and that types of things, a lot of times they're really focusing on like the problem, like what's the problem there? And it sounds like at the retreat, you guys are really giving solutions and you're not focusing on the problem and you're really helping people kind of learn how to live in recovery, right?
And part of that was driven by the insurance industry. They said
Right.
they're not going to really pay to
Hmm.
find God and do an inventory, but they
Right.
will pay to address a co-occurring condition.
Hmm.
So it kind of forced the entire treatment field to move more and more under the umbrella of psychiatry.
Yeah.
Now, that's not to say there aren't a lot of co-occurring issues that need to be addressed, and we certainly have them here at the retreat too. And we have
Mhm.
partnerships with psychiatrists and therapists in the community. So we are a community-based program, and we do access a lot of that for our guests as well. Um, so uh, yeah, it's amazing to watch.
I love it. So what do you think? So you guys have been in business for a long time, and 22 years ago, you came up with this idea. It's working like crazy. How has the retreat kind of grown over the last 22 years?
Well, beyond our wildest dreams,
I
we
bet.
have. It's been amazing to watch. We started as a 19-bed experiment,
Hmm.
and we, of course, in 6 years, we completely outgrew that setting. We moved to the big woods of Wayzata. We now have 169 beds.
Wow.
We've got over
19 to 169. That's
right.
growth.
So we've got 6 sober living homes on Summit Avenue in St. Paul. We've got a women's center, a national center for women's recovery, a men's center, a family program, a spiritual retreat program, kids camps, older adult programs.
Hmm.
We've helped replicate the retreat model in 12 locations around the world. We
Wow.
have the retreat in Auckland, New Zealand, that's been going for a little over 5 years. Coming in November, the retreat in Sydney, Australia will open. And we've had programs that replicated the retreat in Hong Kong and Colorado and Nashville, Tennessee, and all around the country. So I think
Yeah.
that's and that says a lot too about the uh, that people believe in this model of care.
Hmm.
That, with all the treatment we have in the country, um, 10% of the people in America who need help are getting it.
Yes.
So, which is amazing. And so, if we're ever going to really address the issue of addiction in America, we've
Hmm.
got to drive the cost of care way down and make access to care much higher. And the retreat really was about doing just that. So, at $5,400 for a month at the retreat, compared to
Wow.
most programs out there that are in that $30,000 to $60,000 range,
Totally.
most people can't afford to send their son or daughter to their third treatment for another 40, $50,000.
No.
It's just and don't really need to. If they can just put them in an environment where they're immersed in the solution,
Hmm.
uh, it works. So
Yeah. So if only 10% of people are getting treatment, as somebody that's a pioneer in the industry, that's somebody that has been in the industry for a long time, what do you see in the future of recovery? How do you see things changing? What do you see us doing to take that number from 10 to 20 to 30 to 40? What things do you see coming down the road?
I think we have to drive the care of addiction back to the
Mm.
community level.
Got it.
To begin to create cultures of recovery in communities,
Mhm.
sober homes, partnering with outpatient programs, and developing some creative ways to help more people for less money. Um, so access to care is the number one issue. And we're seeing, the field will continue to grow in the areas of, you know, very high-end boutique programs around the country, uh,
Mhm.
where you're measured by your ocean views and 1,200
Mhm.
count bed sheets and massage therapists and fine dining and but that's really not where the solution will be. It will help a small group of people, but if you
Yeah.
really want to help the masses, you got to drive it back to the community level.
Yeah, and $5,400 a month for treatment is gosh, that's a steal. And I love that you've created an environment where cost isn't prohibitive to get treatment. And I agree with you, John. I mean, getting that access to care, driving costs down, but still getting the same results, it seems like the way of the future. And if we want more people to get help, that's what we're going to need to do. So if you're interested in learning more about the retreat and the work that they do there, you can visit them at the website you see on the screen, which is theretreat.org. And you can learn more about all the support that they have here. Now, what I love about your website, John, is this tab programs, all of these programs that you have to really help people and workshops. And want to learn more, submit some information. So you guys are really about a lot of education and helping people understand what's going on with them, right?
Yeah, that's what it's about. It's trying to, connect people with each other, build community. That's what we're all about. It's a caring community model of recovery.
I love that. Cool. Well, thanks for your time today, John. We really appreciate you adding value today. If you're someone that's interested, if you're someone or a loved one of someone that's looking for treatment, we would encourage you to visit theretreat.org to find out more information. We know sometimes it's the hardest thing to do to pick up this 10,000-pound phone and reach out for help. But for a lot of people that have gone through the retreat over the last 22 years, we'd love for you to see that in your life. So again, John, thanks for your time today. Really appreciate you adding some value. And we'll see you around soon, I'm sure.
You're welcome, Danny. It's a pleasure. Thank you.